wisdom teeth. Why is it so common for us to have wisdom teeth removed these days? Why can't anybody hang on to their third molars? Why are some people able to keep their wisdom teeth? So there's a book, you can read about this. It's called Jaws by Sandra Kahn and Paul Ehrlich. So Jaws, there's the book right there. Sandra Kahn is an orthodontist. Paul Ehrlich is an anthropologist. They talk about how our jaws have shrunk over the past several hundred years due to changes in our eating habits. It's pretty interesting. As we've moved to a soft food diet from cooking and processing our foods, our jaw bones aren't being stimulated to develop to be as large as they used to be. It turns out you need more hard chewing in your daily life to fully develop your jaw bones. Honestly, that's a way oversimplified explanation, but you can deep dive into the topic by reading that book if you want. Another book, James Nestor's Breathe, also discusses the same topic, as well as how our shrinking jaws have negatively impacted our ability to breathe over time. So if one of your goals is to raise children with well-developed jaws who have a shot at keeping their wisdom teeth, you might want to check out those books if that is something that's important to you. And it probably should be. It should be on the priority list somewhere. I don't think it's maybe the top priority, but it matters a little bit. So anyway, when should you have your wisdom teeth removed if you're going to do it? If you don't modify your eating and chewing habits to grow strong jaws and you got to get your wisdom teeth out, when should you do that? Wisdom teeth are way easier to remove when you're young. The ideal time to remove wisdom teeth is usually when the roots are about halfway to 2/3 of the way formed. That's typically around age 15 to 20-ish, it's in that range. Varies patient to patient. The problem with waiting for the roots to get longer is that they can get closer to the nerve that runs through our lower jaw, and then you're at an increased risk for damaging that nerve and causing numbness of the lower jaw, chin, lip, and teeth on that side, right? That's not a good outcome. We don't want that. So ideally, if you're going to get them removed, you want to get your wisdom teeth out at the latest by age 25. As you get older, especially past age 30, your jawbone doesn't heal in as well, and you're more likely to need additional bone grafting to help the extraction site heal up after the procedure. So, try to talk to your dentist or oral surgeon when you or your child, if you're a parent watching this, when you're 16, 17, 18 years old, that's when you want to start deciding, am I going to have my wisdom teeth out? Am I going to try to hang on to these things? People have a lot of questions about wisdom teeth. Do wisdom teeth cause crowding of other teeth? No, they don't. We used to think this. It's not true. Turns out wisdom teeth are not strong enough to shove an entire row of teeth forward and cause crowding of your front teeth. You do need to have retainers after orthodontics in order to keep your teeth straight. That's important. But the relapse and the crowding of your teeth are not because of wisdom teeth. Our teeth can end up shifting back to their previous positions due to pressure from the soft tissues of the mouth, the lips, cheeks, tongue, fibers that encircle the teeth from the gum tissue. Those things can all push and pull the teeth back into crowded positions. So after orthodontics, you either need fixed bar retainers behind your teeth or clear retainers or a night guard that you wear at night to hold your teeth in position. But yeah, the teeth don't get crowded again because of the wisdom teeth. That's a dental myth. Not the case, not true. So all of this fuss about whether we should take our wisdom teeth out or not, do we really need our wisdom teeth? How important are they? Well, the truth is most of us don't really need our wisdom teeth to function well when chewing. We do most of our chewing with our first molars. The first molar is a super important tooth. It's a critical tooth. It's the cornerstone of the mouth. It's our workhorse. You want to be taking excellent care of your first molars. They come in at age 6. Treat them well, have great oral hygiene habits, understand nutrition for healthy teeth at age 6. That's on 6-year-olds to know that. No, we're trying to get parents on board with this because that's the most important thing is that parents are training their kids for healthy habits for a healthy dental lifetime. I said that in a way that made sense and that everybody's going to follow what I'm talking about. I'm rambling, but that's the point of all this TikTok and YouTube stuff is to train people healthy habits for healthy teeth. All right, so let's talk about, if you don't get your wisdom teeth removed, what are some of the problems that can come up? What are some of the issues with wisdom teeth? So, not so wise tooth problem number 1, Gum tissue infection. Wisdom teeth can end up with extra flaps of gum tissue growing over them if you don't have enough room in your mouth. These gum tissue flaps can get infected, they swell up, you can bite on them, and it can be pretty painful. It's not fun. A dentist can show you how to clean those gum tissue areas out at home to reduce the swelling, but the best solution is going to be removal of the wisdom tooth so that it doesn't become a recurring problem for you. Not so wise tooth problem number 2, cavities. So wisdom teeth, your third molars, they're further back in the mouth. They're way back there. Sometimes it's hard to clean wisdom teeth when they're all the way in the back of your mouth, That can end up causing trouble as you get older. You get a surprise toothache. I get that you don't want to do an unnecessary procedure in removing your wisdom teeth, but if they're hard to clean, it can make some sense to remove them when you're young before they cause a painful problem that sneaks up on you at an inconvenient time in life when it's also more difficult to get the wisdom tooth out at that point. All right, so not so wise tooth problem number 3, damage to adjacent teeth. Sometimes wisdom teeth come in sideways and they sort of ram into the back of our second molars. This can cause damage to and potential loss of the second molars due to dental decay, gum disease, or something called root resorption. So if your wisdom tooth is on a collision course for a second molar, you might want to get it out. Not so wise tooth problem number 4, cysts. There is a small, I repeat, small chance that a wisdom tooth that is impacted in your jawbone may develop a cyst over time. I've seen this happen with some patients, but it's relatively rare. It's not the most common thing. This is one of the reasons dentists take panoramic x-rays to monitor your jaws every 5 years or so. We're making sure that the jawbone is healthy where we can't see directly. The chance of an impacted wisdom tooth developing a cyst over the course of a lifetime is somewhere around 1 to 3%. So not a huge risk, but if it happens to you, it is a more invasive procedure with higher risks than if you had the wisdom tooth removed when you were younger. Let's say, you have 4 impacted wisdom teeth, you might be looking at between a 4 and 12% risk that one of those wisdom teeth develops a cyst that needs to be dealt with later in life. You get to decide if that's a significant enough risk for you that you want to go ahead and get your wisdom teeth out early. So, do we always have to remove our wisdom teeth? Are there no circumstances where we can hang on to these things? Well, if your wisdom teeth come into your mouth in a normal, upright position and you're able to brush and floss them to keep them clean, then by all means, keep them. Those are good teeth. They're in a good position. Why take them out? You happen to have a well-developed jaw. Congratulations. Also, if you have fully impacted wisdom teeth and they are buried underneath your jawbone and you're already age 30 or older, I would leave those alone. There's a relatively low risk of cyst development. Make sure you're having your jaw examined with a panoramic x-ray about every 5 years because those cysts can sneak up on you. They are not necessarily painful and they can cause a lot of damage to your jawbone without causing any pain. But until there's evidence of a problem, I'd probably let sleeping dogs lie. At that point, don't go poking the bear and making him angry if it's not necessary.